So, Dr. Rooney, how would you suggest somebody brush their teeth?
Well, what I suggest any child or any adult is to hold the toothbrush. This is a child's toothbrush in this case, and pretend this is the mouth of the patient. You always want to be able to brush circular motions, partial bristle on the gum, partial bristle on the teeth, and just start going to circular motion, starting with the back, moving yourself all the way over across the arch on the outside of the gum area and the teeth, then switching to the inside just as much as the outside. Some people forget to brush the inside of their teeth, which is just as important.
Don't I wish I could open my mouth that much so that I
Yes,
could get the
we all
brush in?
do, trust me. So you brush the inside and the outside as well as the tops of your teeth, because they have grooves on their teeth that hold plaque and bacteria, so you want to try to get those off as well. Then you switch to the lower arch, if you had a lower arch, and go all the way around again in circles, partially on the gum, partially on the teeth.
What are signs of brushing too hard?
Some patients I find, especially adults, will grab their toothbrush, especially if they're a righty. I always know that they're a righty because they immediately go to their left side and start to do this. And they usually have a lot of recession in the areas on the upper left side. Patients who are lefty, the same thing on the right side. They'll immediately go up to this area because it's the natural progression of where you want to go with your hand. And they start brushing way too hard here, and they have to start to get recession in these areas, which causes a lot of sensitivity on patients. So some patients believe that sensitivity is caused by they have a cavity, or all of a sudden they take something cold in their mouth and there's something wrong, they think. But it's actually that they've brushed so hard that they've receded their gums. And it's nothing dangerous, but you have to be very careful that it doesn't go too far up. Otherwise, the root is exposed and becomes very, very sensitive for the patient.
I've also heard that brushing should be around 2 minutes. Is that correct?
That is correct. You want to brush 2 minutes minimum on upper and lower teeth as well. Some adult products have even timers, and sometimes I have kids timers, one of those little hourglasses.
Yes.
And they have a 2-minute time as well. So if you want to have fun with the kids, you can buy one of those timers and let them make sure they don't brush less than by the time the sand comes all the way down. So